Hi, I'm Nicole. I'll be your student nurse today. I'm going to wash my hands. Can you state your full name and date of birth for me? Perfect. All right. So the doctor has ordered a blood transfusion. Did he come in and talk to you about it? Great. I see that you and the doctor both signed the consent form. Do you have any other questions? No? All right. So before we start, there are a few side effects that may occur, and I need you to let me know if they happen. So if you feel lightheaded, have any chills or back pain, any itchiness, okay. Have any other questions? No? All right, I'm going to wash my hands. I will set up my normal saline because normal saline is the only solution that you can use with a blood transfusion. So I'm going to make sure all my clamps are shut. Okay, another clamp. All right. So I will prime the bag, making sure that the normal saline is above the filter to prevent any damage to the red blood cells. Oh, I'm gonna clamp this first. Okay, it's above the line. And now I'm going to prime. All right, there's no air bubbles and the tube has no kinks in there. We're working perfectly. All right, so this is all primed and ready to go. I'm going to apply gloves, or wash my hands, apply gloves, and I'm going to assess your IV site. Do you have any pain around here? No? There's no redness or swelling. So I'm going to clean the port off. Without touching it, I'm going to attach the normal saline on a clamp. Make sure it's flowing correctly. It is. Alright, I'm going to re-clamp. Unscrew this. Okay. Reapply the cap. Remove my gloves, wash my hands. I'm going to get your vital signs, listen to your lung sounds, and then I'm going to go get the blood. All right, so I'm going to wash my hands before I leave the room. I'm getting the blood. Come back in. Can you state your name and date of birth for me again? Perfect. All right, I have the blood here. The blood cannot sit out in room temperature for more than 30 minutes before infusion. So I'm going to check the blood for any clumps or discoloration. And then I'm going to gently agitate to mix. And then with another nurse, I will check the blood. So I have the med record number 224466.
224466.
Account number 123456.
123456.
Patient name Betty Jones.
Betty Jones.
Betty Jones. Okay, red armband number 456654.
456654.
Perfect. All right. Patient blood type is B positive.
B positive.
Donor pool number is 7890.
7890.
Units in pool are 4.
4.
Volume is 250 milliliters.
250 milliliters.
Blood component is PRBC.
PRBC.
Expiration date is 12/22/2020.
12/22/2020.
Blood donor type is O positive.
O positive.
Compatibility test is completed.
Completed.
The date is 7/6/2020.
7/6/2020.
Perfect. All right. Betty had no orders for a blood warmer or any special filters. And I'm wearing gloves as I am dealing with the blood. So I'm going to spike the bag, ensuring all the clamps are closed. Yep. Okay. Going to hang the blood, and then I'm going to prime the line all the way to the end, ensuring I'm not wasting any blood. Going to open up the blood clamp. That one's good. Open this up. Okay, the blood's all the way to the end with no wasting. Now I'm going to get a alcohol wipe and clean off the port, and then apply this, opening up the clamp. Okay. I will then put this in the chamber. There we go, turning this on. And once I start the blood infusion, I will be staying in here for 15 minutes and checking the vital signs to ensure there isn't any reactions. All right, new patient, yes. Yes. Let's go. Confirm. Channel B. IV fluids. Red blood cells. Red blood cells, yes. All right, the rate we want is 50 milliliters per hour. And then the volume of the blood is 250 milliliters. So I'm going to put in 200. I'm going to make sure it's open. Everything's unlocked and start. Perfect. All right. Like I said, I'll stay in here for 15 minutes to ensure no reaction is happening and taking vital signs. And then once the blood infusion is done, I will then do a flush through the line of normal saline. And then I will, once everything's done, ensure he's not having a reaction to the blood, I will take down all of my bags and lines and dispose of them as needed. And then I am going to ensure he doesn't need anything. The bed's lowered, side rails are up and locked. Okay, and then I remove my gloves, wash my hands, and I'm done here. So now I threw away all of my supplies. I'm gonna leave the room, wash my hands, and then I would document the infusion site, the time of the infusion started and stopped, the amount of blood, the type of blood, the numbers, the sequence number, and then the sequence number, the gauge of the IV was 20, so it was in the range of 18 to 22, and I would document the size of the gauge, the drip rate, and then that's what I would document. And then I would also document the amount of normal saline that I used for the pre and post flush. I will, for the lifespan consideration, if he had congestive heart failure, I would slow down the rate so he would not have fluid overload. And then for a child, I would use a smaller needle gauge for the safety of the veins to prevent them from bursting. And then, yeah, I'm done.